Good evening everyone. So first of all, special thanks to Dr. Manu Parmar sir, who has given us this opportunity and organized this session. We truly appreciate sir, and also thanks to Dr. Karan sir, Dr. Daksha ma'am, Dr. Radhika ma'am, and my colleagues. So today I am Aloki Patel, and welcome to the seminar of Forensic Psychology and Psychiatry. This field plays a crucial role in understanding criminals' behavior through a legal system. So now I present introduction of forensic psychiatry and psychology. First topic is introduction of forensic psychology. So what is forensic psychology? So it's a study of human behavior. It's used in legal and criminal system. Here I put three topics: definition and scope of forensic psychology, role of forensic psychologist, and application in the legal system. Here we show first topic, definition and scope. Please. Yeah. So forensic psychology. Historical background of forensic psychology. Forensic psychology has evolved significantly over the years, integrating psychology with legal principles to assist in criminal and civil cases, establishing importance in modern legal system. So earlier, law and psychology both are different terms, and now they both are combined and made forensic psychology. Here there are some key principles of forensic psychology and understand people's behavior in legal settings, assist people like criminals, offenders, victims. So here describe the importance of assessment and evaluation and the ethical consideration involved in legal testimony and expert opinions. For example, a psychologist helps the court decide the criminal is mentally stable or not. Like આપણે વાત કરીએ તો કોઈ ક્રિમિનલ હોય એને કોઈ ક્રાઇમ કમિટ કર્યું હોય તો એઝ અ ફોરેન્સિક સાયકોલોજી એ કોર્ટને જસ્ટિફાઈ કરે કે હી ઇઝ મેન્ટલી ઇલ ઓર નોટ, એ ક્રાઇમ કમિટ કરતા વખતે સ્ટેબલ હતું, કોન્શિયસ હતું કે નહીં. So next, area of specialization. So criminal forensic psychology and civil forensic psychology. In criminal forensic psychology, we deal with crimes and criminals. For example, checking if a murderer has mental illness or not. And in civil forensic psychology, it's not a crime, but it's legal system. For example, if આપણે કોઈ child custody હોય, તો child custody કોઈ પણ પેરેન્ટ્સને આપવી હોય. So in civil forensic psychology, કામ કરે કે both parents નું ઇન્ટરવ્યૂ લે અને ઇવેલ્યુએટ કરે કે ચિલ્ડ્રન કોની જોડે વધારે સેફ છે ઓર નોટ. Role of forensic psychologist. So here competency evaluation and risk assessment. So check if a person is mentally able to face trial or not. For example, in competency evaluation, a person with memory loss might not understand court process, and in risk assessment, judge if someone might commit a crime again. And risk assessment નું example है तो prison getting peril. Sometimes criminal get out to peril, and psychologists check they are likely to harm other people or not after peril or without peril. Expert testimony. So here we had courtroom procedure and impact on legal system. In courtroom procedure, psychologists follow strict rules while speaking in court, must be honest, unbiased, and only share facts. And impact of legal decision and examples like a psychologist says a person was not in their sense during the crime, or if he, like crime, આપણે જોયું તો civil and crime both just like crime. Next, applications in the legal system. So first is profiling and investigation. Profiling and investigation help police understand criminal minds and create profiles for suspects. For example, based on crime scenes, psychologists place suspects, age, behavior, and etc. And treatment of offenders. Psychologists give therapy to victim, offender, and rehabilitate individuals, reduce recidivism, and promote positive behavior. And last was civil litigation. Personal injury case and child custody evaluation. In personal injury case, in person psychological assessment help determine the extent of emotional and psychological damage suffered by victims. And in child custody, same as civil case, not criminal, not crime assist, but legal system will find the child was safe with his mother, her mother, or his father. So thank you.
Myself Dr. Meshwa. Today we will discuss about forensic psychiatry assessment. Importance of forensic psychiatry assessment. First of all, definition and scope. Forensic psychiatry assessment involves evaluating individuals' mental health in context of law, encompassing aspects such as competency, responsibility, and risk potential. Role in legal system. Forensic psychiatry serves a critical function in the legal system by providing expert opinion that aid in adjudicating cases, influencing sentencing, and informing parole decision. Components of assessment: clinical interviews, psychological testing, and risk assessment. Clinical interviews in forensic settings are structured conversation that aim to obtain comprehensive information about person's mental health, history, and specific concern the legal issues at hand. Psychological testing includes standardized assessment that measures cognitive and emotional functioning, helping to identify mental disorders and their implication of legal responsibility. Risk assessment evaluates the likelihood of individual committing future violence or offending, integral for sentencing, bail decision, and treatment planning within the criminal justice system. Challenges in forensic assessment. First, informed consent issues, and second, bias subjectivity. Informed consent issues. Obtaining informed consent in forensic assessment is complicated due to potential power imbalance, coercive environment, and individuals' understanding of their legal rights. Bias and subjectivity. Bias and subjectivity can affect forensic assessment as personal beliefs and environmental factors may inadvertently influence the evaluator's interpretation and conclusions. Methodologies used: structure versus non-structured assessment. Structured assessment follow a predetermined format to increase reliability and validity, whereas unstructured assessment allow for more natural conversation but may introduce inconsistency. Use of standardized tool. Standardized tool provide benchmarks and norms for evaluating psychological condition and ensuring assessment adhere to established criteria and enhancing the objectivity of findings. Next part will be covered by Ungal Patel.
Good afternoon, everyone. My topic is fitness to standard trial. Definition to fitness to standard trial. Fitness to standard trial refers to the defendant's ability to comprehend the legal processing and assist in their own defense. A defendant must be mentally competent to participate meaningfully. Jurisdictional variation. Different jurisdictions may have unique criteria for determining fitness to stand trial. Influenced by local laws and legal precedents, this variability can affect the accused's right and outcome of significantly. Assessment the process. Mental state evaluation. Mental state evaluation involves the comprehensive psychological assessment conducted to determine the competency of the accused. These are typically performed by licensed mental health professionals utilizing standardized tools. Role of forensic psychiatrist. Forensic psychiatry play a crucial role in assessing defendants for fitness to stand trial, offering expert opinion on mental health status and appropriateness for trial participation, thus informing judicial decision. Right of the accused. Right to a fair trial. The right to a fair trial is fundamentally in legal system ensuring that all defendants, including those deemed unfit and receive equitable treatment in legal processing, safeguarding the integrity of the justice system, and informed consent in assessment. Informed consent pertains to the requirement that defendants understand and agree to the mental health assessment conduct, ensuring they are fully aware of the process and any potential ramification. Implication of a finding of unfitness. Treatment alternative. When a defendant is found unfit, treatment alternative may include hospitalization for mental health care and psychological counseling or other intervention aimed at restoring competency for trial. These options prioritization of rehabilitation. Re-evaluation procedure. Re-evaluation procedure are implemented periodically to assess if a previously remained unfit defendant has regained the necessary competencies to stand trial, ensuring ongoing fairness and adherence to legal standards. Thank you.
Topic is insanity defense. Historical context. First is evolution of the insanity defense. The concept of the insanity defense has the development over centuries from the ancient legal codes to modern interpretations, reflecting changes in the social views of the mental health and culpability. And second is key legal cases. Prominent court cases like the trial of Daniel McNaughton had shaped the parameters of the insanity defense, establishing legal precedents that influence current judicial practices and standards. There are two rules, criteria for the insanity defense. First rule is McNaughton rule. This rule stipulates that the defendant may be excused from the liability if they were unable to understand the nature of their act or recognize it as a wrong due to a severe mental disorder. Second rule is irresistible impulse test. This criteria assess whether a defendant's mental illness prevented them from controlling their actions or conforming their conduct to legal standard at the time of the crime. Third topic is assessment of insanity. First, role of forensic psychologist. Forensic psychologists play a crucial role in evaluating defendants, employing clinical assessment to determine mental state at the time of the crime and aiding in court territories. Second, challenges in the assessment. Assessing insanity involves complexities, including differentiating between genuine mental illness and feigned symptoms, as well as ensuring objectivity amidst legal and ethical pressures. Fourth is consequences of an insanity verdict. Commitment to mental health facilities. Individuals found not guilty by reason of insanity are often committed to mental health institutions, where they undergo treatment rather than serving prison sentences, emphasizing rehabilitation. Second is civil rights implication. An insanity verdict raise significant civil rights issues, including debates on personal freedoms, institutionalization practices, and the potential stigma attached to the individual with the mental disorder. Further topic will be covered by my colleague Manu.
Mental illness, marriage and divorces.
Introduction.
Patel Unnati, first counseling challenges. Counseling challenges, it is effective communications can be severely hindered by mental illness, leading to misunderstanding, frustrations and emotional distance between partners, thus increase the stress on the relationship. Financial consideration. Mental illness can result in high medical cost, reduced income, potential job loss, complicating the couple's financial stability and often creating additional stress and conflict. Divorce dynamics. Divorce dynamics is ground for the divorce involving mental illness. Mental illness can serve as a basis for divorce, impacting legal proceeding and emotional settlement, often discussing through criteria such as unsound mind and inability to fulfill marital duties. Child custody issue. Determine define child custody may be influenced by parents' mental health status, where courts aim to protect the child's best interests while considering the parents' capability and stability. Legal considerations. First, right of the mental ill individuals. Mentally ill individuals have specific right considering their treatment and custody arrangement, which include the right to appropriate mental health care and fair legal representations. Protecting vulnerable parties. The legal framework, including provisional designed to safeguard mentally ill individuals from explorations and ensure they are treated fairly in divorce and custody disputes. Support system and resources. Support system first is the counseling services. Counseling services provide vital support and navigating issues of mental illness within a marriage, offering couple tools for effective communications and coping strategy for strengthening their bond. And second is the legal aid options. Legal aid resources help individuals with mental illness access knowledgeable legal support and ensuring they receive assistance in navigating the complexity of the divorce and custody matters. Further part is covered by Part Patel.
Myself, R. Patel. My topic is medical negligence in forensic psychiatry. Definition and scope of medical negligence. Legal guidelines. Legal guidelines outline the obligation of practitioner to adhere to standards that prevent harm, establishing a framework for accountability in forensic psychiatry practice. Standards of care. Standards of care refer to the level of prudence and caution that reasonable professional would exercise in similar circumstances to ensure patient safety and effective treatment. Case study. Notable cases of medical negligence. This section reviews significant real-world cases that highlight failure in forensic psychiatric care, illustrating the consequences of negligence on individuals and the legal systems. Outcomes and legal actions related to medical negligence in forensic psychiatry provide insight into how courts resolve disputes, including compensatory damages and changes in practice standards. Ethical dimension. Responsibility of practitioners. Practitioners have an ethical duty to provide competent care, ensuring that patients' mental health needs are met while balancing legal obligation and professional integrity. Patients' rights versus provider protection. This discussion explored the tension between upholding patient right to safe and effective care while also considering the legal protection and responsibility afforded to the practitioners. Prevention strategy. Quality assurance measure. Quality assurance measures are essential for identifying and mitigating risk within forensic psychiatry settings, focusing on continuous monitoring and improvement of the care standards. Training and education for practitioners. Comprehensive training and education for the practitioner ensure they are up to date with the best practice, legal requirements and ethical standards, fostering a culture of safety and accountability. Thank you.
Thank you all of us nicely presented topics. Forensic psychiatry, most important topics in this modern era. Many crimes occurring in our country and all over the world. So this is the aims to discuss these topics, to learn some things about forensic parts. It is all helpful in your life also. In every branch, forensic is addressed. So thank you all for presentations. Nice. बंद कर देते हैं।